How do patients do? You know, you've got these medicines that are really good. They all effectively help the patient. Does the patient suddenly begin to improve their well-being, less fluid, feel better?
Yeah, you know, unlike say a heart attack where we can fix you within 15 minutes, these type of heart symptoms do take a little while to get better. The Lasix is there to help with the fluid and the volume related issues. And yes, they do get better, but it's a 3 to 6 month process of going up on the medicines, being compliant with the medicines, taking them as prescribed, being compliant with a low salt diet, and slowly, you know, and the good thing is Medicare has approved cardiac rehab for heart failure patients now.
So there's a rehab for failure.
There's a rehab for heart failure
Rehab to me means you go to the gym and exercise under guidance.
Yes.
What is it?
Same thing. It's you go there. We have some exercise physiologists, nutritionists that give them dietary information, go over medication, ensure medication compliance. Then they set an exercise prescription and get you moving around. So it's a slow, progressive incline, and they watch them on a heart monitor to make sure we don't have any rhythm disturbances.
That's absolutely fabulous. Does it get to be a club of people that are coming for rehab, and they come and they enjoy, I'm doing better than you're doing, or what's it like in rehab?
Yeah, again, everybody there has a very similar medical condition, obviously. There's a community with it. Obviously, there's depression associated with heart disease and having heart failure and any chronic diagnosis, so it certainly helps with the depression aspects of things. That's kind of, again, mainstay in addition to medications is, can I get you to rehab to at least go 3 days a week?
When you make the diagnosis, when you put the patient on medication, and when they're doing a little bit better and they're able to go to rehab, what do you tell the patient their prognosis is?
You know, part of it depends on what the reason is. If they have heart artery blockages and they've sustained a lot of heart attacks and it's dead heart muscle, prognosis is not quite as good in terms of making that number look better. In terms of viral cardiomyopathies, meaning that, you know, it's a virus that attacks the heart, those patients usually do really well. The big I don't know box, we haven't found a reason, we're going to put you on medicines. It usually follows the rule of a third, so that a third will have minimal improvement in their heart function, a third will get better but not quite back to normal, and a third will get completely back to normal. So,
isn't it great to take a patient with heart failure and watch them improve and guide them and have them come back to you and say, Doc, I couldn't have made it without you.
Yeah, the happiest time is when I see them every 2 weeks going up on these medicines, and for me to tell them it's 6 months or a year now from when I have to see you, that makes them happy.